Okay, we're going to talk about CPT and HCPCS coding. This is a big topic, so we're just going to hit the basics today. Here's the objectives. We're just going to look at the significance behind each coding set, look at the modifiers, and then look at the new tiered CPT evaluation and reevaluation codes, as well as what it means for the everyday PT. So CPT stands for Current Procedural Terminology, and it was first developed in 1966 to help streamline medical records, make it a little more simple. Each code represented a service rendered, and now we're currently using the CPT-4, which was established in 1977, and it's used to streamline billing to third-party payers, like insurance companies. The American Medical Association is actually what governs coding, and it's what keeps everything up to date. And there's a CPT editorial panel, which is made up of physicians, nursing, and even PTs, people from the healthcare field, and they just make sure things are up to date, and they meet 3 times a year. The other side of coding is HCPCS coding, which stands for Healthcare Common Procedure Coding System, and it's made up of 2 levels. Level 1 is the CPT codes that we just talked about, and then level 2 basically covers everything that CPT codes don't. So the big ones are durable medical equipment, prosthetics, orthotics, and other supplies. So what do these mean for physical therapists? Just because there's a code that exists doesn't necessarily mean that it's reimbursed. So we as PTs, when we develop a plan of care, we need to make sure that we're maximizing the benefit towards the patient, as well as making sure those services are being reimbursed. Otherwise, we're not going to have a job for long. So looking at CPT codes, there's 2 big categories, timed and untimed codes. First, we're going to talk about timed codes, which uses the 8-minute rule that we've all kind of heard about. And you're allowed to bill multiple units per units of time. And the big ones that we commonly use in PT are therapeutic exercise, neuro-re-ed, gait training, and therapeutic activity. Other ones are ultrasound, manual therapy, ionophoresis, that are used a little less frequently. And then untimed codes, you're just allowed to bill once per session, and the big ones are your evaluation and reevaluations, but also cold packs, hot packs, and traction. And something new to PT is CPT tiered evaluation and reevaluation based on patient complexity, low, moderate, and high complexity, and then the PT reevaluation. Most patients we're going to see are going to fall into that moderate complexity level based on the number of comorbidities the patient has. The 8-minute rule can be a little confusing, but it's actually not that bad. Units are based on 15-minute increments, and you have to have at least 8 minutes to round up. So once you get to 8 minutes, you have 1 unit, and then an additional 15, you get your 2 units, so that's 23 minutes. So this table breaks it down nicely. 23 to 37 minutes is 2 units, 38 to 52 is 3, and so on and so forth. So here's a little example. A PT designs a treatment with 7 minutes of ultrasound, 5 minutes of traction, 10 minutes of gait training, and 14 minutes of therapeutic exercise. How many timed units are we allowed to bill is basically the question we're looking at. So we're going to count up the number of minutes of timed code treatments, which is 31 in this case because we don't consider the traction as one of them. Next, we're going to apply the 8-minute rule, and 31 falls in between the 23 and 37 minutes, so we have 2 units. And then we determine which of the services we spent most time on, and in this case, gait training and therapeutic exercise, and we don't bill for ultrasound. Next, we're going to talk about modifiers, which basically just adds a little more information to the code, and these kind of explain the circumstance around it. So there's codes out there that distinguish right and left limb. There's codes out there for each finger on your hand as well. There's new, used, and rented equipment codes. One that I used at Lutheran during my 4-week explained the degree of impairment that the patient had. So we use this to gauge the progress in treatment. And then finally we have OCE Edits, which is the Outpatient Code Editor. And basically it audits the codes that we're using and makes sure that there's no mistakes. And if there are mistakes, it explains how to correct them. And it lines everything up for payment indications, discounts, and adjustments. So it integrates the codes, the modifiers, and the ICD-9 codes. And here's the references.